1.3 billion population hard, though. So what has been the real impact, especially to the poor? Dr. Anbumani Ramadoss, an MP and also former Indian Health Minister, joins us now live on the line. Welcome to Newsday. Given the figures I've just read out, the lockdown so far seems to be working. What is your assessment?
Hi, good morning. But firstly, I'd like to wish your Prime Minister and all the other people affected by COVID-19 in your country a speedy recovery.
That's very kind of you. Thank you.
Again, coming back to the issue, yes, we have a lockdown of 3 weeks. And in fact, according to my assessment, we need to extend it by another 2 more weeks initially, and then by another 1 more week. That's actually about 3 weeks. In India right now, we have about 6,200 positive cases with about 199 mortalities by this corona. The Indian Council of Medical Research recently has said that we are in between stage 2 and stage 3. And there are some pockets in India where maybe community transmission may have started. But the good thing is that now we have started community surveillance, and a lot of states in the country have gone actively into the system where the clusters have been identified, the hotspots have been identified, and in fact, good work has been done to contain this, to prevent it becoming the stage 3. So
yes, because
we need to extend this lockdown.
The lockdown has been pretty effective, hasn't it? We've had borders between states closed, schools, offices, factories, parks, restaurants, airspace all shut. But I guess the worry has to be, as you say, community transmission. When you're talking about a country where millions of people live in dense slums, is the lockdown in and of itself going to be enough?
Here we don't have a vaccine, we don't have medicines. The only thing is social distancing. And for that, India needs a lockdown. As you said, there's 1.33 billion, closely knit population, not much awareness, a lot of people, under poverty people. On poverty, all these factors are here. So we need this lockdown to be extended again. And because one is, today we have identified these clusters, like you say in Mumbai. The clusters have been identified. The hotspots have been identified. And people have been quarantined. So we need a little more time for them to be more active. And for that, we need an extension of lockdown. When Prime Minister Mr. Modi spoke to me last Sunday, I also suggested to him that the lockdown should be extended for 3 more weeks. And some people may argument otherwise because of the economic issues and food shortages and all these things. But then,
where are you looking as a country then? Because we're all talking about testing, about vaccinations. I mean, how far along are you with a testing program? Are you looking to other countries to import the tests, or are you developing tests yourselves?
Currently we are testing with the sufficient amount of kits. And also now we're getting some more kits from China as well, the rapid testing kits, where the efficacy, according to me, will be just a little more about 50%. But those rapid testing kits are going to be used only not for the actual patients, but then the patients' known persons, the relatives, or the persons who are affected by them or are surrounding them. Currently, yes, I agree that we are not gone on more testing, and the protocol, which is the ICMR has been asked the government to do, is to test highly symptomatic people. That's till about 2 weeks back. But today the testing has increased. But coming to the other part of this, India, a population of 1.33 billion, the mortality by corona is about 199 only today. And I could say the entire Asia as such per se, where this epidemic or pandemic has started from China, the bordering countries like Mongolia or Vietnam or Cambodia, they haven't reported even 1 death, whereas Hong Kong has about 4 deaths, Taiwan has about 5 deaths, Singapore has about 5 deaths, Malaysia is about 65, Thailand is about 30, Bangladesh 20, Nepal, Bhutan no deaths, Sri Lanka 7, India 199, Pakistan is about 40. So taking into consideration of the entire Asia, that's my assessment, over Europe or the United States, I feel that yes, we may have an innate sense of immunity. It may happen, and I hope I'm right, against this virus. And also
Thank
the other
you for the
factors
update.
like...
We were going to have to leave it there, but we thank you very much for giving us your time here on Newsday this morning. That is Dr. Anbumani Ramadoss, MP and also former Indian Health Minister, joining us from Delhi.
20 minutes after 6 o'clock in